Welcome to the Heartbeat Podcast Show. Today we are talking about breast cancer awareness, and as we all know how important breast cancer is to us as humans, since we've been told that breast cancer does not only affect women, but it affects men also. So it's a call for all of us to embrace. Today I have with me Miss Catherine Odichi, who is a principal nursing officer at the Department of Surgery of the University of Ghana Medical Center. Catherine, you're welcome.
Thank you.
And I am your host, Dr. Nanadra Kunedu. And today we are going to zoom into the nursing care when it comes to breast cancer. So, Catherine, tell us, if, let's say, I detect a breast lump and I see a nurse, what can the nurse do for me?
Okay, thank you. So, in the early stages of breast cancer, the moment you detect that you have a lump, the first thing to do is for you to report to a health facility.
Any health facility?
Yes.
Okay.
For a clinical breast examination, which is the first step
Okay.
of diagnosis. So, the first stage, like you asked, if somebody detected a lump in her breast or his breast, because now males also have it, so we'll be using them. The first thing to do for the individual is to go to any healthcare facility
Okay.
for a clinical breast examination. While there, yes, the nurses would assist with the breast examination. We also check their vitals to be sure that every other thing with the person is fine. That's the first step. When a diagnosis is finally made, that's after the person has done a scan, a mammogram, and it's established that there is a lump, the nurses are providing support to the patient depending on the kind of treatment that would be designed for the person, because we realize that treating or managing breast cancer has become individualized, and we pick the treatment regimen depending on the person's case and the stage of the breast cancer. So for the early stages, if it is surgery that we are going to do, we assist with the preoperative management and the postoperative management until the patient has been discharged and has left.
Okay.
For those who have also come in the critical stages, we provide holistic nursing care,
Okay.
as in assisting them to perform activities of daily living such as bathing, feeding, clothing themselves. And then we also liaise with the other healthcare professionals.
Okay.
That is the physiotherapists, the clinical psychologists, because it can be very draining.
Okay.
We also liaise with the dietitians because we have to modify their diets and tailor it to suit the individual based on the assessments that have been done.
So you're trying to say that if somebody is diagnosed, it's not one cap fit all.
No, please.
It's designed
Yes.
specifically for
Yes.
that person.
So we provide individualized care.
Okay.
So based on the person's state and the disciplinary team that is going to, the multidisciplinary team that is going to manage the person. But the nurse and the patient are at the center of it all.
Okay.
Because you, the nurse, you step in as an advocate between the patient and the nurse, or a liaison between them, to ensure that they get all the professionals on board
Okay.
to be able to assist with their care. Yes. So like I mentioned, we are doing an individualized nursing care for
Okay.
each patient, depending on the state of the patient and then the plan that the team has.
Okay.
Because on the wards, we have a whole lot of disciplines or professionals. That is, like I mentioned, the dietitians, the physiotherapists, we have the doctors there, we have oncologists there,
Psychologists.
clinical psychologists as well,
Okay.
even including the porters and everybody that comes into the team to make sure that the patient is having the best of care, and we provide that comfort for the person to survive, or depending on the stage, like I mentioned, if it's in the end stages, we'll have to help the person into a peaceful death by nursing the person to a peaceful death. Yes.
Well, if it's in the end stages, we have to help the person by nursing the person to. That can be traumatizing.
It is very traumatizing. And it can be draining for both the patient and even the healthcare professionals, especially the nurses.
Because you know that, this is the end of that.
You are seeing situations where you can't really do much about. You wish you could do something, but unfortunately, where the person has gotten to, you are going to nurse the person by the days and then provide specific needs to the person. Yes, if at this point the person needs to get a bath, you provide it. Feed, if they can tolerate, you provide it. Or look at other feeding options which have been discussed by the team. Yes.
Okay. All right. So the various teams that you have, right? Let's say somebody comes in, right? And the person comes to see you at the OPD. So the general OPD care when it comes to breast cancer, because you are doing breast cancer awareness. So somebody comes in, the person says that I want to come, I've heard about the breast cancer awareness as it's being done at the UGMC now, where you work. And the person comes in at the OPD. What does the nurse do for people who walk in to have their breast cancer checked? Because UGMC is advertising that they're doing free or subsidized breast screening. So if the person walks in and meets a nurse, how does it start? I want you to take us through that step so that when somebody is watching, the person wants to come there to do the screening, the person will know what to expect.
Okay. So when you walk into the facility, especially UGMC, we have designed a place where we are doing the screening. And so there are nurses there. There's a professional there who's also helping you to do your registration, And then the nurses will check your vital signs, will check your weight. If there is any anomaly, would prompt the doctors. The nurses are also doing the breast screening together with the doctors so that they would ask you questions that would help you to be able to fill up your forms. They would also help you to be able to identify if you have a breast in your lump. Will refer you to see a doctor or even get a doctor to come and confirm that indeed there is a lump, after which we will assist you to book and get your scans done or a mammogram done. If you need to come back for a review, we are also there to assist you to do your bookings as well, and then till the end of the journey, whether you are being admitted for a procedure or whichever plan we have for you, we are going to assist you to do so.
Okay. So as Catherine has said, at UGMC, there's a plan, there's a team that is going to see through what you have to do in booking for your examination and screening and all the other things, the mammogram and ultrasound that you have to do. As the month of breast cancer awareness is here, that is the theme for the year is detect it early, treat it right, and survive it, right?
Yes.
Okay. So in detecting it early, what do you have to say to people on what they should do so that the detection early can happen?
Okay, thank you. So if we are telling you to detect it early, what we are saying is just know your breasts. And
How do you
can
know your
your breasts by doing a self-breast examination on monthly basis. Yes. So that if you do something on the regular, you will know yourself and know that this is the size or shape of my breast. This is how my breast looks like. So that immediately there is a change, you'll be able to detect it. Yes, that's why we are saying you should know your breast. So when you continuously do the self-breast examination, the moment you feel something that is not normal with you, you know that you need to run for assistance. And I don't just say that to the females, especially those who have partners. They can even help them to detect the lumps. Yeah, it may be funny sometimes, but if you are helping somebody to, especially when those who are intimate, you'll be able to detect if there is a change in your partner's breast appearance.
Okay. You were saying that it should be done monthly. Is
Yes.
it any time of the month? Because I know that
I was coming to
during ovulation, Some people, you have some hardness,
Engorgement.
So is it any time? Because if you do it at that time, the probability that you may miss it is high, right?
Yes.
So at what times does it have to be done?
Okay. So usually the self-breast examination is done 3 to 5 days after you have had your monthly period. That is for those who are actively menstruating. But for our postmenopausal mothers or women, we encourage that you pick a day in the month, a specific date, because for them, there are no changes in their cycle. So you pick a specific day. Let's say if it's the first day of the month, you pick every first day of the month so that you'll be able to stick to it. If it's the last day of the month, you pick every last day of the month so that you're able to stick to it, and you do so continuously such that if the moment there is a change, you will pick it up.
Okay. So for those menstruating, they have to do it
3 to 5 days after.
So 3 to 5 days post menstruation.
Yes.
Okay.
And the postmenopausal women,
they should just
pick a day in the month.
Okay.
So that they stick to that day.
On that note, I would like to acknowledge our sponsors, and this podcast is brought to us by Thyroid Ghana Foundation, supporting thyroid patients and creating awareness of thyroid diseases, Adenta Credit Union, Building Dreams Together, the Salt Pal Smart Online Shopping, Tulipa 365, Hair and More, 1115 Restaurant, Eat, Relax and Connect. So these are our supporters for the Heartbeat podcast, one heartbeat at a time. On this podcast show, we discuss matters of concern with health, well-being, and lifestyle. So if you want to comment or ask any questions so far as this episode is concerned, please do well to put it on the comment section, share and comment, and we'll send the questions to our guests to answer it, and we'll bring you the responses. Catherine, with the breast cancer awareness that is ongoing, roughly off head, do you say that the people that visit, do you often see people with lumps, or they just come and most of them are just clear?
Okay, so over the period, the people we've screened, we've picked up a few lumps.
Okay.
And as at now, we are following up on them to do their imaging, that is the scans and the mammograms, to be sure that whatever we picked up, if it's a growth or a lump, it is not cancerous. If it is, we have made them understand that it's not just ending there. It's a journey we are going to go on with them. We are going to follow up with them until we get to the end. That is for their treatment, for their follow-ups, even if it means they have to come for surgery or whatever plan we will have for them. Like I mentioned earlier, it is individualized. So we are treating them as individuals, but then we are following up on them.
Yeah.
Yes.
We know that nursing play a critical role when it comes to care, and especially when it comes to surgical care, because we know that the doctors can do it all. And this one, most of the burden in terms of healing, and then giving the drugs and all that falls on nursing. Can you educate us if somebody has to do a surgery and they are on admission? Can you educate us on what care nursing plays when it comes to surgery on the surgical ward?
Okay. So for our preoperative care, that is preparing somebody for or before a surgery, it entails a whole lot. Right from admission, getting the person into a room that the person is comfortable with, educating them on the protocols of the unit, that this is what we do here. If they have any questions, they will ask. We try to make them settle in. We also make sure that their vital signs are optimum, such that it will not impede surgery. Yes, so that if there is any anomaly, quickly we would prompt the doctors, and then if we have to do something about it, we'll do so. We also make sure that their medications are ready for surgery. We make sure that they have signed their consent forms, because yes, you have to give us consent before we take you to theater. Every other preparation that needs to be done, we make sure that we follow up through to make sure that the person and the team is ready for the surgery. If we have to administer some medications before surgery, we do. If we have to stop some of them, we do. Yes, so that's basically what we do pre-op. Or if we have to, let's say, transfuse somebody, give blood before the person goes into surgery, we do all of that to make sure that on the day of the surgery, the patient is actually ready physically, mentally, physiologically, everything to be able to go onto the table for the surgery to be done. Yes.
Okay. And after the surgery?
And after the surgery, when we bring the patient back into the ward, we make sure that yet the vital signs or the state in which we are receiving the patient is the best. We move them back onto their beds, and then we do a close and continuous monitoring of the patient so that immediately we detect that there is something wrong with the patient, we act accordingly. So for the first few hours, we are doing close monitoring. That is even sometimes 15 minutes, 30 minutes intervals, just to be sure that the person we have received is in good hands and is doing well. That's for the first few hours. After which, we make sure that they are getting their fluids, getting their medications. Because it's early, we have to still provide their baths for them. We make sure that everything that they were doing before the surgery will assist them to be able to perform those activities. That's the activities of daily living.
Okay.
Yes, we assist them to the washrooms, the bathrooms, etc. And we feed them if necessary. That's if the plan is to start feeding, we feed them when necessary. We also make sure that we are helping them to get out of bed. And by so doing, we are liaising with the physiotherapists to make sure that they are working so that we'll be able to discharge them to go home and continue their lives at home. Yes, that's for those who go through the surgery.
Okay.
And after the surgery, we're also dressing their wounds.
Okay.
Yes, to make sure that they are not at risk of infections. That is something we do not want. So we are dressing their wounds in a manner that the wounds will not go bad to prolong their stay on the ward.
All right. And so after they are discharged and they come for review, that one too, what happens? What do nursing do?
So post-discharge, we educate them on how, before they go home, we educate them on how to go about their activities, the things they can do, the things they cannot do, some specific exercises that are related to the breast surgery. Okay. Yes, we also teach them how to do so and how often to do it and the things to avoid in order not to come back with complications. When they come back to the hospital after discharge, depending on their state, that is if their wounds are not healed yet, we still do the dressings for them. We ensure that they are following up on their teams, especially those who are going for chemotherapy or radiotherapy or whichever plan that has been slated for them. We make sure that they are following through with their plans, and we're also liaising with the other disciplines to make sure that their journey is smooth.
Whoa, nursing is too stressful.
We are
Should
managing.
I put it like that?
We are trying our best.
Should I put it as too stressful or it's too engaging? Which word
Nursing,
is?
it can be both stressful and engaging, but
Okay.
all in all, that's why we are there to provide the support for them.
Okay. All right. So all in all, that's what nursing is there to provide the support for all of us. So let's keep on. Anytime we have any issue, let's go to the hospital. Early detection saves lives. You are watching us on the Heartbeat podcast, one heartbeat at a time. And today with me is Miss Catherine Odechi, Principal Nursing Officer, General Surgery Department of the University of Ghana Medical Center. Before we go into Catherine helping us to show how we'll be able to do the self-examination, Catherine, what's your general comment to those watching us so far as the breast cancer awareness month is concerned and so far as breast cancer examination is concerned? What would you say to everybody?
So, like this year's team is saying, detect it early, treat it right, and then survive it. I would say that with the detection, let's do well to make sure that we are getting our breast screened by ourselves and by the clinical team. Treating it right, the moment a diagnosis is made that Madam Akosia or Madam Ajwa, we have found a lump in your breast, so we'll have to do something about it. We should not run away. We should not get scared. Let's make sure that we are working with our healthcare professionals to give us the best of care. Because most of the time, you realize that you diagnose people, they get missing, they run away, you don't find them again until they are in worse states. So we are saying treat it right. Let's seek help with the professionals so that in all we can all survive breast cancer, because we have most people who have survived breast cancer, but we are hoping that we can get more and more people surviving it by treating it right.
So, as you've heard, when you are diagnosed with any form of breast cancer or any lump is seen, please do not run away, because as we know, early detection saves life. Come and let's work on it together. As Catherine had said, that we work with you throughout the journey. So come and let's work on it together. Before we zoom to the self-examination, which Catherine is going to show us, we would like to say a big thank you to all of you watching us. If you have any questions, please don't forget to put it in the comment section. We'll send it to our guests and they will provide answers, and we'll get back to you on the questions. You are watching the Heartbeat podcast, one heartbeat at a time. I'm your host, Dr. Nanadwa Kunedijani. Catherine, thank you very much. Now, let's zoom to the self-examination.
Thank you.
Thank you.
Okay, so for the self-breast examination, you don't actually need a whole lot of things. You need a mirror and yourself.
Okay, so let's say I'm your mirror.
Yes, so you need to stand in front of a mirror, undress, so that you'll be able to see your breasts. So once you stand in front of a mirror, the first thing you do, or you can even do it under a shower where you can see a mirror.
Okay.
So the first thing you do is to raise your hands into the air.
Okay.
And while at it, you look into the mirror, then you turn to your side, you look at the breasts, then you do the same thing for the other side too. When you are done, you put your hands on your waist, and then you do same. You look at your breasts.
Okay.
And while at it, we are looking for a few things, specific things. We are looking for the color of the breast, the size of the breast. We know that already the shape of the size of the breast, they are not so equal. That's not what we are talking about. We are looking for significant asymmetry. That's if it's so clear that one breast has become bigger or changed from the other. That's what we are looking at. We're also looking for dimpling of the breast. So you know how dimples are.
Yeah.
If you should find a dimple on the breast, it's a cause for worry. Also for the skin, we are looking for something called orange peel appearance.
Okay.
That's the peau d'orange, like the technical term we use. We don't want to see such. The skin on your breast shouldn't look like an orange, that of the orange or the lime.
Okay.
Yes. It should be so smooth, or something that you know it to be.
Yeah.
And then for your nipples, you want to see if the nipple is retracting.
Okay.
Because something retracted nipples, that is
The one that is
has
going
gone
inside. Yeah.
like it's going back inside. You also have to look out for that one.
Okay.
While doing so, you have to look into the mirror. For those who are well endowed or have big breasts, we encourage that maybe you support with the other arm so that you're able to see
The
under of the breast, and you do same for the other side too. So when you are done inspecting, for the first part we've done is the inspection. Now we are going to feel it, and that is what we call the palpation.
Okay.
So for the palpation, we are using one hand to do for the other part of the body. So if you want to do for your left breast first, means you have to use your right hand to do it. If you want to do for your right, you have to use your left to do it. So you can stand in the mirror. If you want to examine your right breast first, you put the right arm at the back of your head.
Okay, like that.
Yes.
Okay.
And then we are not using the tip of our fingers. We are using the palm.
Okay.
Or the parts of our finger parts to do it.
Yeah.
And we are using these 3 fingers. Yes. So you look at your breast, and we do it in a certain fashion, either clockwise or anti-clockwise. Yes.
Okay.
So let's say we want to go anti-clockwise. Yes. So you touch firmly from the side,
Okay.
and then you press, you go down,
Okay.
and then you make sure you have covered every
All
part
over.
of the breast.
Okay.
And you can do it round until you have touched every part. And the final part is you touch the nipple, you make sure that you are squeezing it to find out if there is any discharge coming out from the nipple.
Okay.
Yes. A part we usually forget is that our breast steals from our armpits.
Yeah.
So we have to make sure that we are paying attention to feel for lymph nodes in our armpits.
Okay.
So we are going to do the same for, and then we go with the depths to make sure that we feel the whole armpit to make sure that nothing is hiding there.
Okay.
And we are going to do the same thing for the other side too. Yes. Right. And then when you are done, you can bend forward to make sure that sometimes the lymph nodes, some appear from here. Yeah, so make sure that if you are finding something or you are looking on, because sometimes it hides here, and then because we do not pay attention to these sides, we are not able to see it. So we have to cover the whole breast, and we are doing this. You can do it while standing or lying down. Okay. But the most of the times we prefer that people stand
so that they can look at the mirror and
do it very well. Okay. You can even ask your partner to do, but because it is you, we want to make sure that you are feeling it and knowing your breast, so that the moment you detect a change, you'll be able to run for cure. Yeah. Yes. So thank you very much.
All right. Thank you very much, Catherine. So that is what goes into the breast self-examination. And we are happy to have you, Catherine Odichie, Principal Nursing Officer at the Department of General Surgery, University of Ghana Medical Center, for coming to educate us on nursing care so far as breast cancer and breast self-examination is concerned. This is the Heartbeat podcast show, which we say that one heartbeat at a time. And I would like to acknowledge my sponsors. Today's episode is brought to us by Adenta Credit Union, Building Dreams Together, the Thyroid Ghana Foundation, Thyroid Health and Patient Support. Thank you very much, and see you. And once again, don't forget to subscribe, to share, and also post your comment in the comment section. See you again. Thank you.